Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons, on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Doctors Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz Podcast will surely satisfy your podcast fix. All right, now let's dive into this episode.
Welcome back to the Fuller Butz Podcast. I'm Dr. Daniel Butz. I'm with my wonderful co-host, Dr. Samuel Fuller. It's the new year, 2025. How has it been starting out for you? Any resolutions started, broken? How you doing?
2025, are we out of our minds? It's going great. Dry January ended for me yesterday. Had one drink with a friend that was in town. But otherwise, trying to just do better work-life balance, trying to establish more hobbies besides podcasting, and just enjoying family, trying to get my kids to ride bikes without training wheels and pick sports that they enjoy. What about you? What's going on up in Milwaukee for 2025?
It's been cold this week. It's been busy. I feel like I haven't had a chance to stop working since the new year started. But yeah, ice froze over, so we were like out skating on the lake, which was fun. We did a polar plunge, which was not so much fun, but had to just get out of the house. I don't know.
Do you time yourself for how long you're in there, or do you just jump in and get out?
I think the the water was like 32. It was really cold in Lake Michigan. So yeah, it was a quick dip, and my family bailed when they got to their ankles. So I did not dive all the way in. Always striving to be healthier, exercise more, just that balance, and get back from a long OR day. It's hard to do it, but I gotta, older we get, we gotta try to maintain. I'm excited for 2025. 2024 was a big growing year for us, adding new surgeons, getting them fully up and running. So it's the year ended up well and seems to be rolling over, and lots of changes. We talked about some of these in our recent podcast, but I thought today we're going to kind of hit on what we kind of expect or think the trends will be in 2025, and how that might be different from 2024, and what's kind of changing in the world of plastic surgery.
Plastic surgery predictions for 2025, and hopefully during season 3 of the Fuller Butz Podcast, a year from now, we can reflect back and see if our predictions were true or false, or if we were on target. So why don't you start us off with your first bold prediction for 2025, and it has to do with fat transfer, fat grafting, liposuction. What's going to happen in 2025, Dr. Butz?
I think we've mentioned this a few times way back, this new product, AlloClae. I think it has a potential to kind of be, provide a new option in this fat grafting market. We see a lot of patients who just don't have a lot of fat to harvest, to transfer. So AlloClae is an off-the-shelf product in larger volumes, so 15 cc's and 30 cc's. It's still not commercially available yet. They're kind of working through the FDA clearance stuff. But from talking to colleagues and seeing some things, it seems very promising, long-lasting results. So filling in those hip dips we talked about, we talk a lot about a bad liposuction as well from these centers. So someone has contoured anomalies from liposuction could be used for that. So I think it has a lot of promise. Again, we need to see the data, make sure it's really worth it for patients. But I think that could be an exciting new thing that will be available and hopefully rapidly expand.
Yeah, perfect case scenario, if you have a patient who doesn't have a lot of fat, but they have a hip dip and they don't want to spend money year after year injecting a filler or dealing with their hip dip, to have something that's potentially off the shelf, similar to fat, that they want to use that has the potential to last a lot longer. That's very intriguing, and I'm sure there's going to be high demand, not just for hip dips, but throughout the body.
Yeah, and again, also no downtime, right? We're not doing liposuction. We don't need anesthesia. It's just a little numbing and quick in office thing. So it could be a pretty sweet tool to add to our toolbox.
Bold
Um,
prediction there, Dr.
it's
Butz.
bold. It is bold. It could not ever come out either. So, um, what's on your top of your list?
Well, we talked about New Year's resolutions and having motivation. I'm going to talk about the Motiva implant. So, bold prediction is that everyone listening is going to see an advertisement, some marketing for the brand new to the United States, although not a brand new company or implant, the Motiva implant, which some of my staff members say that it seems like it's more of a GI medication, like sounding rather than a breast implant, but I kind of like the sound of it. Motiva is marketing itself as the very lowest, safest, and highest satisfaction rate implant to come out in some time. It was FDA approved end of 2024 and is making its headway. I think about it a lot like a new restaurant, a new coffee shop coming to town. So it kind of opens up and you got this line out the door. And then as the dust settles, is it here to stay? Is it going to be as popular? Is it going to overtake some of the lasting giants and the pillars of the community in plastic surgery? And so up until now, we've had Sientra, we've had Allergan and Natrel, we've had Mentor, and now Motiva is using their ergonomics technology for the gel itself, their 4-micron smooth silk shell that is supposed to reduce inflammation. It's Blue Seal safety technology to reduce quality control issues, and its monoblock technology to really link the internal implant with the external shell to really make it one cohesive implantable device into the breast. So this is something that Dan and I have both are registered plastic surgeons who provide this to our patients, and I'm predicting that Motiva is going to make a splash in 2025, just as this new kid on the street when it comes to breast implants. Dan, what are your thoughts on that bold?
Yeah, I think it's a great implant. It's always good to have competition. I'm sure it's going to make some waves for sure. So yeah, definitely I've been using it a few times. Patients have been happy. Expect to be using more of that, but still very happy and like the implants I traditionally use as well. So, but good to have options for patients. But certainly they're doing a great job marketing, and everyone will probably see that implant at some point in time.
Let's talk about 2025 predictions when it comes to prevention. Dr. Butz, what do you got?
Yeah. So, if you look at the data, there's the younger and younger patients are getting into Botox and kind of preventative Botox. And patients in their 20s often don't even have wrinkles, but often looking at their parents saying, oh, I don't want those 11s. I don't want those forehead lines. How can I prevent that? So, getting preventative Botox, using medical grade skincare to help in good sunscreen, prevent sun damage, prevent those fine lines. It really does work. It takes an investment, takes time, but you either start it and do it early, or you're 50 and you're getting a really extensive facelift or being resurfacing. So there's a lot of great options. I know we talked to some medical spa providers here about these different services that can be done, and I think that's going to continue to kind of take off as younger generations are seeing the long-lasting benefits. Just look at the Golden Girls versus celebrities in their 40s now. It's like night and day, and a lot of it's because they've been utilizing all of these newer technologies. And
you watch a lot of Golden Girls?
Oh, tons. I know. Yeah, they're my favorite.
So the word that I was thinking of before was taboo. So I think that is what you were predicting, is that I think we're going to see 2025 less of a taboo around tox fillers, medical grade skincare. Everyone's doing it, and it should be normalized. It should be okay. These are safe things. We're not, putting in poisons and toxins into our body that is leading to undue harm. If you want to look refreshed, you want to maintain your beauty, you want to really invest now to not have to be paying for major, large surgical procedures and issues down the road, then Dr. Butz is predicting the younger population continues to push through with preventative plastic surgery.
Yeah, I gotta give a shout out. One of our favorite things, is the forever young BBL, broadband light treatment. And if you get 3 of these a year, literally it's been shown to kind of genetically reverse DNA damage. So it's pretty remarkable. If you're consistent with a very low, there's pretty low downtime, no downtime really. It's pretty little redness for a day, no flaking or anything like that. Can really dramatically improve your skin quality. Just got to be consistent.
Awesome.
So you mentioned taboo, and I think that kind of leads into, kind of a phrase we've heard a few times, the Pilates or kind of ballerina kind of body trend, which is very different from what we were, seeing a decade ago with the Kardashian BBLs. Want to talk about a little bit about that prediction?
I think 2025 is really going to see that the natural, aesthetically pleasing plastic surgery goals are here to stay. That we're not trying to single out and only treat patients who want to look overdone, that really want the significant, drastic changes like you saw in the TV shows surrounding nip tuck and things, where it seems like if someone's going to get a breast augmentation, you're putting in these bowling balls inside of there. And that's just not the case currently. So I think 2025 is going to continue to see trends of smaller implants for patients who are high on fitness, high on working out, whether it is Pilates or other lifestyle choices, that they just want a refresh. They want to gain some upper pole fullness, and the safety features of the implants are wonderful. The downtime and recovery is very acceptable, and so I think it's very much more enticing and less taboo to have a small, breast implant or a minor liposuction or a mini tummy tuck or a smaller procedure, to really get rid of whether it's laxity from pregnancy or a cliff or a ledge from adhesions from a C-section, or simply just having some, spots that you want to optimize. Plastic surgery is more mainstream, and I think we're going to see patients asking for realistic touch-ups, augmentations, as opposed to the big, huge, transformations that, some listeners, some viewers think is the only candidate for plastic surgery. What are your thoughts on that, Dan?
Yeah, I think this has been a trend that's been evolving for a while. I probably have more patients come in saying they're worried it's going to look fake and they want it to look really natural than the alternative. But I think in the newer technology, we're talking about Motiva, these newer gel types can really provide really natural results, but give you some, allow, even small B cup bras to fit nice and perky, full, kind of still give you some of that shape you're looking for. Again, especially in very fitness focused patients, Pilates, whatever it might be. Again, with these newer implants, subfascial is even an option, so you're not disrupting the muscle. That muscle preservation technique is really, that's been a very dramatic shift. We've seen in some of our colleagues almost, switching 100% to that. So I think it's, I haven't gone that severe with my, subfascial versus dual plane, but it's definitely an option for more patients because of the newer technology that's out there. Not just Motiva, but even the, soft touch.
Yeah, I think just newer technology as far as anesthetics and, perioperative management. And I think just not having drains and having less nausea and having a recovery and, access to this to be done safely is optimal. And whereas, plastic surgery, think about it, 80s, 90s, similar to travel, it was expensive. It was hard to get to. Now you can get anywhere you want in a safe way. And I think that plastic surgery is also one of those things where we are attractive to patients who don't want a lot of different, issues. That maybe they just have a belly button hernia and a little bit of laxity, and we can touch that up. It doesn't have to be a massive transformation. And the goals that we're seeing is going to be more realistic, more of that ballerina body. Bold-faced prediction 2025.
And spinning off of that, talking about, skin laxity things, and this is again, rolling through 2024, but, the Ozempic skinny shots, I think more and more patients are having, getting easier access to these. I think as the companies are ramping up production, cost is going to come down. The more studies they do, they're often finding more long-term medical benefits. Oftentimes if you're kind of more higher BMIs, but lowering that cardiovascular benefits, joint benefits. But again, the result being, skin laxity and more skin removal, tummy tuck, torsoplasties, whatever that might be, breast lifts, facelifts. So I think that's going to continue to, trend even higher than it has been.
Yeah, I think the major drawbacks when it first came out was cost and side effects. And I think that both of those are being tweaked and worked on to make it more accessible, hopefully. And then also with having some changes in the pharmacokinetics so that you have less of the upset stomach, less of the nausea, throwing up, with that delayed gastric emptying. If they can minimize the side effects and make it more available and cost effective, then I think the patients are going to be reaping benefits from the overall health of being lighter, of having less heart, lung, joint problems that we're seeing. And we're going to be left with many patients who have lost weight in a sustainable way with laxity in their arms, thighs, belly, back, bra line. And we're going to continue to see those cases as huge wins and rewards for these patients who have worked hard and have really been committed to making themselves healthier.
Was there one more? There's one more.
There's one more, and I think we can both just hit on it. I think internal bras are here to stay. We talked about it last year, but I think that even more so, having some support. One patient described it as a insurance plan for like a trip. Just if you're going to invest a little bit in having an internal bra or a mesh, which is a dissolvable, usually suture-based framework that goes away within 6 months to 2 years to really give you a predictable result of where your implant's going to be. I think more patients are going to be opting for that, and more surgeons are going to be wanting to not, I wouldn't say roll the dice, but not have to deal with a revision as frequently, even if it's a 2% revision rate and it goes down to 1% or 1% goes down to 0.5%. Anything that you can do to optimize safety, to optimize patient satisfaction and results. And I think internal bras for that.
Yeah, a few years ago, I was kind of just mentioning it occasionally, and now I tell every patient about it because, it's the more I use it, the more I just see, again, just subtle benefits from it, and some big benefits, but again, it's I think a really big change, the shift that's happened over the last several years. It's definitely going to continue.
And one prediction to combine the two is that because of the new arrival of Motiva, I think internal bra is going to be even more important because of its lack of reaction. And I know Dan and I, we've talked about this on a few other episodes, but because your body's not really creating as much of an inflammation or a capsule or a pocket, I think even more so do we need to ensure that implant's going to stay where it needs to. Certainly that surgeon technique, you want to create a dimension just equal enough for the implant to fit in, but instead of relying on that patient's tissue to hold it into place when there's not going to be a lot of inflammation or reaction to it, I think an internal bra really helps to create a safe, reliable, consistent result.
Yeah, absolutely. I'm excited about 2025. I think it's going to be a great year. Keep on keeping on.
Yeah, we'll see if these come to fruition or if there's something else that breaks the mold. But 2025 is going to be great, and hopefully more Fuller Butz episodes as well.
Yeah, excellent. Well, we'll talk soon.
All right, man. Take it easy.
Yep.
Thanks so much for tuning into this week's episode of Fuller Butz, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butz are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @FullerSurgeryMD or @DanielButzMD. That's Butz with a Z for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butz.